That was too loud. I had that up too loud.
Maybe a little.
Now I'm awake. In studio, and I love it. I love it when I'm in studio and I have a guest that comes and visits me. I'll introduce him in very shortly, but I love a guest that also brings me gifts. I mean, it is the season of giving. Thanks, Nicholas. Thanks for the book. That's awesome. I look forward to reading that.
We did a nice little book exchange, actually.
We did.
So that was nice.
Yeah, I gave you the Blue Ocean strategy. I'll just bring you. This is. I always go. There's Nicholas here, Nicholas Steele. Let's get his little name bar up there. And I did initially booger the name, but we figured it out.
Yes, we did.
There we go. You're floating at the top of the frame there. I just noticed, but we're just gonna roll with it. It's too late.
All right.
It's too late. Little bit about yourself, sir. How did you find out? Like, what brought you? Because this is a dental, related world that we're representing. What brought you to dental now? Like a little bit first about your history.
Yeah.
Where you're working, maybe a little bit of your education.
100%. So, yeah. Thinking that a pharmacist could come into the dental field, a little bit strange, maybe at first glance, but so I was formally trained as a clinical pharmacist from UBC, and I did a few years of practice, mostly in geri psychiatry at the Island Health Authority, and then came back over here, started working with Fraser Health. I'm working with them to roll out their new electronic medical record system called Meditech Expanse. And that's my background. Mm-hmm. So then how does someone like me get into the dental field? Sort of a strange story. So most of my family is actually in dentistry.
Oh, no way.
Yeah, my mom's a clinical instructor at UBC.
Nice.
Yeah. And she does sort of their hygiene modules, and my uncle is a dental tech, actually.
Oh, where does he work?
He retired recently.
Okay.
But he was the tech behind DentalRx.
Okay.
As their lab.
Nice.
So, yeah, dental lab.
So a registered dental technician.
Yes,
that's
right.
They're very cool folks. They're the backbone of the industry. So hygiene, your mom's clinical instructor.
Yep.
UBC, that's cool. So you're the language then?
Yeah, I know some of the language,
yeah.
But like I said, my training's pharmacology and pharmacy based.
Well, I will tell you, Nick, once you get sucked into the dental world, we don't let you go. So just so you know,
okay.
It's a thing. It is actually a thing. Once you enter dentistry, the world of dentistry, you never leave. Cool. And then you mentioned, sorry, you're also working in the hospitals currently while building your new product.
That's right. So yeah, I work at Fraser Health full time in clinical informatics, and we're rolling out their electronic medical record system. The new updated system, which is essentially bringing everything into electronic based platform
and
instead
now,
of paper systems.
What's the push? Like, you get pushback from docs with that? Like, they're used to old systems. I know there's there's a few practice management softwares and systems that they're pretty archaic and have been around for a while. Mm-hmm. So how's that journey?
Yeah, so it's been good. There's been lots of good feedback and adoption, but like as you mentioned, everything. You know how whenever I roll out the system, I actually just rolled it out at Chilliwack. The system, the adoption curve is sort of like an S. So you have sort of people excited-ish at the beginning, and then the S goes down, right? And everybody hates it.
I totally get that.
Yeah, and then it goes back up, and then it evens out, right? So
there's no bell. It's an S.
No, it's an S. Yeah.
I think that's what happens in most cases, maybe.
Yeah.
Upfront excitement, and then followed by
this is terrible.
We have to do this.
Yeah.
Wait.
Yeah.
Change. And then, oh yeah, this is okay.
Yeah, we call that the valley of despair. Right?
But does it like the S goes back down though?
Oh, so yeah, the S actually just plateaus. Yeah, ignore that end of the S.
There's no end of the S.
Yeah,
okay,
that's right.
We'll have to figure out another character for that. But I like that.
Maybe a 5.
A 5. No, 5 has like
a
real sharp drop off at the end.
Oh, that's true.
That's a fail.
Yeah, that's no good. That's no good.
Oh, awesome. Okay, so
but yeah, to your point actually on the dental ecosystem, I've noticed so coming from pharmacy, there's this big push for interprofessional collaboration, right?
100%.
So I went into that thinking like there might be some pushback with trying to collaborate with dentists, but being in contact with the dentist, everybody has been so welcoming and accepting of someone like me, like a pharmacist coming in. And truthfully, like pharmacists are often seen as like those people that just fix all your mistakes, right? So nobody likes pharmacists and the fact that like we're always pointing out what's wrong.
So that's pharmacy culture is like you're like the I guess you have to be though.
That's right, because we're always checking prescriptions, right? So if we're checking everything, we only call you if something's wrong. Yeah. We're not calling you if something's right.
Yeah,
right? You don't want to hear us if something's right.
Oh no, what did I mess up?
Yeah. So that perception is definitely there.
Oh no, I'm gonna throw this guy like into like this low blood pressure scenario.
Exactly. Yeah. So we come with that sort of stigma, I would think. But everybody in the dental community has been super great. All really accepting and wanting to embrace new technologies like DentalRx, which is the software that I created.
Pharmacy is such an interesting realm to me. It's like body chemistry and the amount of like I can't remember what I think it was for a subscription for my daughter or whatever. I was talking to the pharmacist and he's like, what percentage of the population is on some sort of pill? Like, a very high percentage.
I got stats for you, actually.
Oh, great. I love stats.
Yeah, I got stats from StatCan.
You prepared.
Actually.
Oh, this is
I did
great.
Prepare.
Oh, awesome. Let's hear this.
Yeah, so actually, Canadians 40 to 80 years old, actually, there's 50% of Canadians in that age range that are on 5 or more medications.
Wild.
Yeah. Insane.
5? Okay, so 5 or more. So what would those typically encompass? Like a blood thinner for cholesterol, that kind of thing, or thyroid stuff?
Yeah, so there's a few different realms, right? So like let's say, let's actually give this example, right? Someone has a heart attack, right? As soon as they have a heart attack, they're essentially baseline always on 5 meds right after getting out of hospital. Yeah. Right? So you have your aspirin, right? Clopidogrel or ticagrelor, which is for like additional blood thinning. You have them on an lowering cholesterol medication, so a lipid lowering medication, Ramipril usually for lowering the blood pressure, and then depending on the patient, you might add on like something like metoprolol for slowing down the heart. Okay. So that's 5 right there.
That's wild.
Bam.
Yeah.
Like instantly right out of hospital. And we know for these patients too, it can be quite overwhelming, right? Going from 0 to 5.
I tell you, like my dad, we just put him into a care home and sorting out his medication was like, it's wild.
Yeah. There's so many, right?
Yeah.
And they probably come in blister packs.
These blister packs. Yeah, that's right. We had to make sure that was all right. Yeah.
Yeah. So that's actually where I want to ask you is when you see a patient come into the dental clinic, do they usually tell you their medications or how many medications do they tell you?
No, with our clients, like we have actually, and this might be something you want to add into your program as well, is that's usually all covered on like an initial form.
Yes.
Yeah. So that sort of stuff is important, especially when you're introducing, any like freezing agents. That's very important information. Definitely. So like a general information grab, 100%. Yeah.
So are the patients filling those out, or are you grabbing that information from PharmaNet?
Well, that, mostly is them, whether in a clinic where it's, on a physical piece of paper form or, in a lot of our cases, like we're pushing to go to more of a digital form
I really like
system.
those forms,
Yes.
actually.
Yeah.
Dr. Colin, on his website, he has
Yeah.
an amazing form for collecting
Yeah.
medications.
Do you know how amazing that is, especially when you're taking that information from that form and then auto putting that into the practice management software?
Yeah, I'm sure that's super helpful,
Yeah.
right? Because also there's the fact of recall bias, and also what I noticed when I was first actually consulting in dental clinics is you ask the patient about their medications, or you get them to fill out their medication form.
Mhm.
And what I did for a specific dental clinic in Steveston is I set up their pharmanet. So pharmanet's a provincial-wide system
Sure.
that you can look at patients' medications, and you compare what the patient tells you or writes for you to their actual pharmanet, and you notice usually they're missing at least 2 or 3 medications.
Oh, really? And that
Yeah.
could be a big deal.
Yeah.
Yeah.
Especially when, so this is also, I guess, an interesting point of why aren't the patients giving you that information, right?
Maybe they just, that's a very good question. Are people even aware of all the medications that they're taking?
Yeah.
Or are they just okay, I'm going to the pharmacy. I gotta take the blue one at 8:00, and I gotta take this yellow looking one at 7.
So
yeah,
I think I've narrowed it down to probably 3 main causes.
Okay.
Right. So the first one is, like you just said, the patient either doesn't remember or just is oh yeah, it's the red and white one. I take that one in the morning. And then you're there's a million red and white pills, but I'll try and guess which one.
It's actually now it's blue. They've changed it.
Yeah, they changed it to the blue one. Yeah.
Yeah.
We're in the Matrix still, right?
Yeah. That's right. Oh,
yeah.
Well, we can get into that.
No, we'll not get into
that.
That's
our next episode.
Okay. Yeah. But yeah, so they'll tell you, they don't have a great insight into their medications, right? So that's one point.
Mm-hmm.
The other point is, they might not feel it necessary, or they're worried about telling the dentist their medications. So
why is that? Is it they're ashamed of it? Or?
Yeah. So in some circumstances, there's probably shame.
Yeah.
Associated with certain medications.
Sure. Yeah, I'm taking Viagra. What? Right? Whatever.
But what people don't think is Viagra actually substantially increases your blood pressure.
Yeah.
So much so that epinephrine might put you over the edge.
Right. Or in the case of a blood thinners too.
Yep. Those things too, right?
Yeah.
And then the third reason is actually directly related to dentistry, which is what I think is somewhat of a stigma around dentistry, in that dentists are taking care of my teeth.
Mm-hmm.
They're not taking care of my health. Why do they need to know?
They would argue.
Yeah.
They would say, listen, Nick, your oral health greatly impacts your overall health.
Of course.
But anyways, I totally get it.
Yeah.
And that comes to different practices. The psychologist is working on your brain. The gastrointestinal surgeon is doing surgery on your intestines.
That's right.
Yeah.
And I would make the argument that going to the dentist is a healthcare setting that requires you to have all of your healthcare information readily available to that practitioner.
Right.
Right. So again, I think it's that perception around dentistry where the patient comes in thinking, they're taking care of my teeth. My teeth are my teeth. They're not even bones, right? Right?
Yeah.
And then the patient doesn't disclose that information because they don't see it as a medical
relevance.
Yeah.
Yeah.
Right?
Yeah. I totally agree with that psychology for sure.
Yeah. So I think that's where that education with the patient of saying, hey, we need to know your medications
Yeah.
because this can significantly impact your treatment.
And some front end teams out there are fabulous for
100%.
making sure that they make that abundantly apparent how important that is.
Definitely,
Yes.
definitely.
Yeah, especially if patient is now coming in for some specific treatment.
Yeah.
That might put them at some risk in that sense.
Yeah, agreed.
Mhm.
Agreed.
So you're making it easier. Yeah, that's where we're going.
Yeah,
I love it. Yeah.
That's the goal.
Because I will tell you one thing, like in this industry, like if you have something that makes somebody's life easier, they're gonna take two looks at it.
Yeah, that's good. Because that's the whole idea, right? Like reducing those resistances and reducing those barriers, especially with patients too, right? So one thing that I mentioned actually that's available here in BC is actually pharmacist. Pharmacist recently became available for dentists.
Okay.
And one.
Now, would you say this is something that the folks in the industry are aware of?
I don't think so, actually.
Okay.
Most dentists that I talk to aren't aware that pharmacist is available to them.
Okay.
But it is super helpful for things like DentalRx. If you know all of the patient's medications to begin with, then you can input those medications right into the software. And then they'll give you insights as to practice pearls and stuff like that.
Oh, cool.
Yeah.
So that you have it up on screen here.
Yeah.
Do you want to let's take a look? For
sure. So we'll go through the software a little bit. Is it going full screen for you?
No. You can. It's not important, but there we go. That's good. That's good.
Works.
Yeah.
Okay. So DentalRx again is sort of a pharmacology platform where dentists can research medications, calculate doses, safely prescribe, and then ultimately provide better patient care. So what I mean by that is when you can look up medications, you can do that either through the patient med history module or the prescribing monographs module. Monographs are sort of like your classic tool that you might have seen in school, right? So we can look through any medications, for example. Let's take ketorolac, right? We get this nice screen where we can see all of the information about ketorolac, what the doses are, as well as if the patient has kidney disease. So again, like a lot of information that is relevant to dental practice where we might change how we prescribe based on the patient's condition.
Cool.
But the other module, so patient med history, this is sort of where I was talking about, where if you have the patient's medications, you can input them all into the software, and then that will give you actionable insights on how to guide dental treatment.
Quick pause here. Back to that topic. How are we able to extract this information from the patient?
Yeah. So
do you have some suggestions there on how to do that?
Definitely. So in pharmacy school, there's all these training, right, on how to get information from patients, and we call those like 7-minute interviews, right? In the dental clinic and even in pharmacy, those interviews are usually shortened down to 3 minutes. But again, it's establishing that rapport with the patient, making sure that they understand that this is a healthcare setting. Pharmacy has the same problem, right? Patients come in, they think, oh, you're just giving me my drugs.
So there is like I know that like PharmaSave will have like a system in place. I guess maybe if they're, the patient is going there to fill their subscriptions for everything. I mean, I can see there being danger if a patient was kind of going to different pharmacies for different subscriptions.
Yeah, so that's where pharmacist comes in.
Okay.
Right? So pharmacist is essentially the patient's entire.
You're learning me here. So it's like it's like a government database.
That's right.
Essentially, yeah. Okay.
Yeah, exactly. So
and that's all driven by Health Canada and that kind of thing.
Yeah, you got it.
Yeah.
So literally, whenever a patient fills a prescription at a pharmacy, it's logged into the pharmacist database, and that's done after the prescription's been filled. And then all of those fills are essentially shown on a report that can be pulled by any licensed practitioner.
See, I'm okay. Like I don't know, so I ask.
Yeah, well,
so it's great to have guys like Nick here. You know,
that's sort of what I'm saying is like the push for Pharmanet for dentists wasn't really there, and why wasn't it there?
Yeah,
I don't know.
But you know, like we're looking at you know, dentists now performing more complex cases, right? Like if we look at you know, implants, or you know, even like a case of a full mouth reconstruction where they're opening up the soft tissue and removing bone and you know, anchoring in a prosthesis. Like there's some big deals going on in the dental world these days. It's not you know, it's a lot more than like people's perception of you know, just the I need to go get a filling or a root canal. Like the things that that a dentist is able to do in practice now is pretty significant. Like you think of airway and all that's like moving jaw position and
your guys' scope is massive, right? And you mentioned a good one, which is airway, right? So sleep apnea
is huge. Like a lot of folks don't know that they can go see their dentist for their sleep apnea. We actually have a really great client in Langley that's his whole practice. That's all he does.
And that's huge impact to health, right?
Oh, geez, like this. You know, we could throw stats around on the effects of long-term sleep apnea, and it's like devastating to the body.
Definitely.
Like, have you seen? There's some videos online, and I've been through like a couple of sleep apnea like sessions. They'll play that video where the guys basically, like, people are basically choking to death at night. And there's like the pressure that puts on their cardiovascular system, and it's pretty wild.
Yeah. And then coming back to medications, like when the patient comes in, right, and we're looking at the, like, I guess the orofacial arrangement of the nasal cavity and such, but there's also medications that the patient might be taking that also affect that, right? Or
sleep medicine, right? Like,
terrible. Terrible, right?
Like my dad, like, man, we had to like cut that back. Like, it's sleep medication.
And because, there's a whole thing on sleep medication.
Oh, I'm sure. Yeah.
But
like, are you getting proper REM sleep with sleep meds? Like, is it?
Yeah. It's the evidence is not there.
Okay, right? Well, that's episode 3.
Yeah,
we'll do episode 2 will be blue pill, red pill, the Matrix.
Yeah.
And then episode 3 will be sleep medication.
Sure.
Awesome.
But you think about how useful it'd be for the dentist to have all that information on those medications.
100%.
Thinking like, if the patient's even taking something so simple as like Gravol, sometimes people take NyQuil.
Sure.
Right?
Yeah.
NyQuil for sleep.
Yeah.
It's targeted for sleep, but it's Benadryl essentially.
Yeah.
Right. So you're giving the person Benadryl. You're drying them out with anticholinergic side effects. Maybe that's why they can't breathe at night.
Yeah.
Right.
Right.
And that all contributes together in like the realm of healthcare. Right.
Yeah.
So when you see a dentist, you're not only seeing them for your teeth, you're not only seeing them for sleep apnea, but you're seeing them for your health overall.
Yeah.
Right?
Yeah.
So that's where I think, again, coming to back to DentalRx, I think understanding how the medications affect the patient's health and also oral health, we can get a much better.
Well, yeah, like health. This is now providing them with an additional service they can provide their patients.
Yeah. Yeah. Definitely. Right.
Yeah.
And that's coming back to the med history here. So,
see how I always try and derail the conversation.
It's all good.
Yeah.
It's all good.
I love tangents.
No, because they're important though.
Right? You have to go on thought journeys.
Yeah.
I call them thought journeys.
I agree. So in terms of like introducing additional value to the patient, right? So if we have a few things here, we can add medications that the patient's taking to our list.
Now, can you create patient profiles on here? And
not yet.
Not yet? Is that a plan?
I'm working on it with Google their like Google Cloud Services as well as the Google Startup Program, maintaining HIPAA compliance, and specifically in BC, FIPA compliance.
Yeah. PIPEDA.
Or PIPEDA. Yes, you're right. Sorry, not FIPA.
Yeah.
Is quite strict, and for good reason, right?
Yeah. And I mean, if you look into cybersecurity right now, one of the number one targets is medical history.
Yes, definitely. And there's been some big breaches in the past year and couple years going back, and it's terrible to see, right? But
it's a big thing at the dental clinic too. There are huge targets.
Yeah, and you don't want to see your software, of course, being the target of that, and of course leaking. There you go,
another tangent journey, another thought journey. Okay, so this you're now inputting. Let's re-explain what we're doing. We're inputting different medications that the patient is taking.
Yep.
We've done our questionnaires, and we're confident that patient is giving us all the information.
And then we're given this report. And in the new year, I'm going to make this report printable.
Cool.
But we'll go over sort of what's in the report. So we have...
Well, I can see this already. Like I think, if we're copying and pasting and putting this on the patient profile in the practice management software.
Yeah, exactly. So
you can do, so patients coming in, they fill out a form, medical history form that includes their medication. There's some specific things. It's a risk case. The front end team does all the research, does the lookup here, and then prints off that one page, and they're informed.
Yeah, exactly. So there's a few things here, right? So from the practice side, you have a specific report, right, that has, are there any dental drug interactions? Are there any like pearls that I should be paying attention to? And then there's also the patient side, right? Like maybe the patient isn't as aware of how their medications are affecting their health. A printout like this, maybe not so technically worded, or for example, like medically worded.
It's not like, to the layman, it's tough to decipher what it means, right?
Definitely. Yeah. So getting a medication list for the patient saying, hey, these medications are affecting your oral health. Whether you want to change that or not is your discretion, right? Patient discretion. But
you would hope that GP is having that discussion with them as he's subscribing.
Yeah, but there's a few things on that end, right?
Yeah.
So the GP...
I opened up some drama?
Well...
Yes, I found some.
It's not so much drama. Yeah. It's just... I'm not going to say anything bad about...
No, of course not.
Prescribing practice.
It's
right?
It's a system.
Exactly.
It's not the specific people's problem. It's the system.
Definitely. Yeah. And the system's overburdened. B, there's everybody has their own prescribing practice, and people want to fix their problems, right?
Sure.
Like the physicians are trying to fix that patient's problem.
Yeah.
And unfortunately,
because they've got like 5 more people lined up to come and see them to fix their problems as well.
For sure.
Yeah.
And the thing is, you can prescribe a drug to fix that problem, but you could also prescribe exercise. But does the patient want to do exercise?
I mean, if we think of long-term success. Yeah.
Yeah. Right. Yeah. So there's that whole can of worms.
This is our red pill, blue pill conversation.
Man. Yeah.
Next. Yeah.
So there's that whole sort of practice area, right? Where we want to solve the patient's problems, but we also want to give them a solution right now.
Right.
And to do that, usually you prescribe a medication, but medications also have their own side effects. They have their own risks and dangers.
Long term, right? Yeah, for sure. We're introducing chemicals into the body that our liver has to
definitely.
Yeah,
and then consequently, those have effects all over the body, mouth included. So,
especially if we speak in terms of like drying somebody out.
Yeah.
Our saliva is actually a great defense against caries, cavities.
Definitely.
Yeah.
And that's a huge one, right? So there's this whole list of medications called the Beers list not beer.
It is
for
Friday. It's
drinking.
Friday. Yeah. You got me excited.
Not beer for drinking, but
Yeah.
beers is in the last name of the person who came up with the list.
Gotcha.
And these are all anticholinergic medications that really, essentially, the easiest way to describe it is they dry the patient out. So all mucous membranes become drier, and subsequently the mouth becomes like the desert, right?
Well, I mean, I've got a good friend that's he's a gastrointestinal surgeon, and like I'm a nerd. I love to like just explore conversations with like. He's like, Mark, I don't want to talk shop. I'm like, no, come on, what you're doing is really interesting. But yeah, like the the colon is like such a huge hydration center.
Yes, definitely.
Huge
you're
hydration.
reabsorbing all the water from there, right?
Yes.
Yeah. So, yeah. There's so many things that affect the body, and medications being a big part of that. And if we can understand how the medications are affecting the mouth, that can make not only our dental practice better, but it can also significantly impact the patient's health moving forward past the appointment, and also during the appointment too, right? Because there's also intrinsic risks.
Sure.
During the appointment, within the appointment, you introduce anesthetic, you introduce epinephrine, right? Sometimes, and then other prescribed medications as well, if they need, like if they have an abscess, for example.
For sure, antibiotics and all that stuff.
Definitely.
You know what? And it's, I mean, if you're able to add somebody that you're going to see every 6 months onto your team of advocates for your overall health, and they have this information too. The dentist, when he pops in to have that conversation with you, how are you doing? He can also, or she, sorry, he or she can also have that conversation about the overall health question. Like,
that's another huge thing.
Yeah.
It's like people go to see their dentist you say 6 months, but I think it's supposed to be 3 months, right?
Yes, if they're on a perio program. So if they have issues with their gums, soft tissue, they have deeper pockets, which means like receding gums.
Gotcha.
They need to go in and make sure that that's being cleaned more often.
Yeah.
But a typical person every 6 months should go and have a cleaning hygiene appointment.
Okay. And that's once every 6 months or once every 3 months. That's a direct primary care provider interaction, right?
Yeah, absolutely.
Where you can, again, catch all of those health benefits if they're being screened for.
Yeah, that's amazing. I love it. That's really cool. And I know a lot of great dentists out there that like they are advocates for their patients. They really do care for their patients. And in a lot of cases, it's their dentist for like decades, you know? That's, you know, like if I think of my own dentist, I've been going to see him for 35 years.
Yeah.
Right?
So, yeah. And
29 years.
29.
Yeah.
So, you have that relationship already too, right? So then
there's such a huge trust thing there too. Yeah. Yeah. I like my wheels are turning here. It's just a really cool.
Yeah. So
idea.
Again, you can also increase that trust by saying, hey, I know what medications you're on and I know how they're affecting your health and I want to help you with that too, right?
So here's the devil's advocate here. I'm going to throw this one at you. And,
sure.
So a lot of folks out there, like when it comes to radiography.
Okay.
What they see, they're responsible for. So in this case, if they're aware of these things and they miss something on a medication, and you know they're you know, are they liable?
Yeah.
For this now?
That's actually a really good question.
Yeah.
Because
I wanted to try and stump you. So.
No, that's actually one of the first questions where I implemented this system. That's what the dentist asked me.
100%.
She was like, "Oh, maybe I didn't want to know all this, right?"
Yes, because you will get that. You're going to get that.
Now I have all this information, and maybe I don't know what to do with it right off the bat. But that's where I'm trying to deliver actionable insights with DentalRx, because let's say, for example, another pharmacology platform that's pretty well known is LexiComp, right?
Okay, yeah.
So LexiComp gives you all this information, and also PharmaNet in general, right? So PharmaNet, you can get all the patient information get all the patient medications. But what do I do with that?
Sure.
Right?
Here's a question. Are people able to contact you if something comes up that's of concern?
Yes. So in BC specifically, because I'm only licensed to practice in BC,
yes,
you can contact
me.
me.
There you go. That's the solution.
Yes. But
you're at fault.
I'm at fault. That's right. So it's on my practice.
Sorry, Nick.
Yeah. But that being said, we're hoping to bring in the future, over the next few years, maybe a pharmacist in each province.
Yeah, right.
And we'll see where we can go from
Very
there.
cool. I think that would be the solution.
Yeah.
Or even in a case where you can do like a full-on virtual consultation.
Yeah, and that's actually part of the application as well. We already thought of that.
Yeah. Oh man, I try to give you some cool tips.
No, yeah. So virtual consultations are sort of part of the app. We have a messaging system where you can message me specifically. Right. But again, that's only in BC right now. Because legally, I was told.
No, you got that. Yeah. I mean, I'm sure you've also, involved a lawyer and make sure that you have all your bases covered for sure.
For sure.
Yeah.
But like I was saying, with that dentist, right? So the dentist was worried, like, oh, what if I have this information and I don't know exactly what to do with it? So from there actually is where most of DentalRx came. So I mentioned I was consulting before, right? And providing like the information on the patient profiles in the management software? practice management software. Yeah. But then it's like, oh, what do I do with this? So then I came up with DentalRx, and we can see here. So when we put in all the patient's medications, we get these dental drug interactions, which essentially tells you, I also didn't want to make them so long, right? Sometimes you get this information that's so overwhelming, right?
Sure.
But this is essentially your most common interactions. So don't give the patient tetracyclines if they're on diphenhydramine. They might have extra anticholinergic effects. You can also sedate them more if they're on diphenhydramine, right? And then take a look at their salivary flow. And this took me 30 seconds to go through, right? So however many medications they're on, take 30 seconds to briefly go over these, find any actionable insights, and then go ahead with your treatment plan.
And I'm sure, over time, doing this for multiple patients, they're actually educating themselves.
Exactly.
As well, right?
Yeah, exactly.
Yeah. I'm sure there's commonalities out there with
100%. Yeah. That's right.
Unless you get some sort of alien, right?
Yeah, we don't want to see those.
Those non-humans. Oh, we got a non-human coming in today. He's on all sorts of meds.
Yeah, strange.
Yeah, that's episode 4.
4.
Medication for intergalactic patients. Yeah.
That's right. But coming back to Earth, though.
Oh, I love it. Yeah, you did it.
We're so if we. A few things actually. So I'll tell a story with actually that same clinic.
Yeah.
I won't give any names or anything.
No. Yeah. That's always
don't
throw anybody on the bus.
Right?
Rule of thumb.
Yeah. There was a newer practitioner there, and the patient was already on a baseline level of corticosteroids, right? And they had a tooth extracted. And the question was, we want to decrease swelling after the tooth has been extracted, but we don't know how much corticosteroid load the patient's already on and how much we need to give additionally going forward. Now, in your practice, how would you go forward with this?
I don't have a practice.
Okay. Nope. Yeah. Okay. So I can tell you the patient prescribed an additional dexamethasone 4 milligrams twice a day because they thought that they might need additional corticosteroid because they were already on corticosteroid, right? As a baseline. This threw the patient into Cushing's syndrome, and then they got admitted to hospital.
Oh.
Yeah, unfortunately. So what I hope to do with something like DentalRx is avoid those types of problems, right? So if we looked up, for example, the patient was on prednisone. we can see that we need to determine the dose and duration of steroid therapy to assess risk for stress tolerance and immunosuppression. And then the total corticosteroid load also needs to be assessed too, right?
There you go.
So the hope is to provide these insights so that those types of interactions and sort of hospitalizations in the worst case scenario don't happen.
Risk management.
Yeah, definitely.
Yeah.
So
don't run around the pool.
Yeah, don't run around the pool. That's right.
Yeah.
That was I would say a rarer incident, but there's also lots of minor incidents that happen in the dental clinic that are not always reported either, right?
Well, I'm sure too when it comes to like healing time.
Exactly.
Yeah.
So there's a few things around that, right? So yes, if the patient's on anticoagulants, for example, should we hold those anticoagulants before therapy, or should we just leave them? Is there a greater risk of stroke if we take them off their anticoagulation? In some circumstances, yes. In some circumstances, no. Is the patient on warfarin, or are they on rivaroxaban and apixaban? All different things contributing to our clinical decision-making process that we need to understand, right?
Right.
So all those things combined together make our clinical decision. But if we make that clinical decision perhaps non-optimally, because it's not technically incorrect if you don't hold it or you hold it. But if we make that decision non-optimally, sometimes healing process can take longer. And what does that do to the patient's perception as well, right? So does the patient, if they come in, they get a painless tooth extraction, and then they leave, and then they heal in like 1 or 2 weeks. I don't actually know the healing time, for dental extractions. But if they heal faster than they normally would, that's a good experience, right?
Yeah, 100%.
Versus if they call the doctor saying, "Oh, I'm bleeding like crazy.
Inflammation.
Yeah,
I got a headache.
Super swollen."
Yeah.
And then the patient, that's not a good patient experience.
No.
Right?
Yeah.
So working on both angles there.
I've seen you thought of all the angles. That's a great point. That's, part of that experience extends past the visit.
Yeah.
100%.
Exactly.
Yeah.
And then maybe that impacts as well future case acceptance, or there's also the stat of like, I think 30 to 50% of patients were like scared of going to the dentist. Right?
Oh, yeah. Yeah.
So
anxiety's high. It's a tough place to visit for some people. Yeah.
So if we can make that less stressful, not only by providing a good experience after the appointment, but also dentists can prescribe triazolam prior to appointment, or nitrous oxide prior to appointment as well. But maybe the reason that you don't prescribe that, or maybe a reason why you withhold that, is because you don't know the patient's medication history, or you don't know how that's going to affect the rest of their medications. Yeah. Whereas with DentalRx, we can figure that out.
Yeah, that's awesome. There is also, the sedation dentistry is an option out there. Some people provide that as well.
Definitely. Yeah, I think that's a great service.
For like super anxious or, big cases that are major extractions or implants and that kind of thing. Yeah.
Yeah, and that's a great service. My wife actually recently had all of her wisdom teeth.
Oh, yeah.
Out. So, we went to a really good dentist in Richmond. Oral surgeon in Richmond.
Anybody you want to give a shout out to?
I'm not going to lie. I don't actually remember his name.
Sorry.
Right, you're testing me here. I don't remember.
I'm not. It's okay. It's okay. Thanks, Richmond oral surgeon guy.
Yes, thank you.
Awesome. This is really great. So I see you got some more stats and stuff written down. Is there anything?
Yeah, you see this?
I wanted, I know you are a guy of like, wow, this is a really good pearl. Like you even put it up on your service. Like, What other pearls can you offer? And there's some stuff written down. So
yeah, there's some stuff written down. So we went over the fact that 50% of Canadians 40 to 80 years old were on 5 or more medications, right? And this is considered like a polypharmacy case, right?
I even heard there's some sort of, I don't know if this is true or not, like even our wastewater is like saturated in antidepressants.
I would imagine so.
Yeah.
There's a huge, I could go on an entire podcast about the pandemic of antidepressants and all this other stuff.
That's red pill, blue pill. Yeah.
It's a whole thing.
Yeah.
But anyways, moving on to an additional stat is that over the next 20 years, our senior population will increase by 68%.
Yeah.
Right? And that's 65 plus.
Yeah.
75 plus will double in the next 20 years.
Jeez.
So you think about that.
Yeah.
Applying that back to our our stat can.
Everybody needs to know this information for their patients.
Definitely. Applying that back to stat can, that means that, where's my note? 75% of patients will be on 5 or more medications.
Holy moly.
So 3/4 of your patients will be on 5 or more medications. And then thinking about that, in your practice, do you notice that that's how many medications people are telling you? Are they not telling you some of those medications? Do we need to establish a better patient relationship and trust in that regard?
I mean, yeah, you talk about, the rare cases, sure, but all the minor incidents, you're rolling the dice.
Yeah, sometimes
those folks are they're going to be coming through your practice
definitely
at a higher percentile.
Yes.
So be prepared.
That's right. 75% of elderly patients, right?
Yeah.
Will have those 5 medications or more.
Wild.
So yeah, it is a crazy stat. And you think about our population dynamics, right? It makes sense, right? All the baby boomers are getting older.
Yeah.
So with that looming, it's called the looming health crisis, right?
Boomers.
Yeah.
Sorry, we're not laughing at you. It's just,
no.
I just think calling that
it's just
demographic boomers it's
a meme, right?
It's silly.
Yeah. So yeah, that sort of crisis is coming, right?
Yeah.
It's not to be like all doom and gloom, right?
No, but it's let's not run on around the swimming deck. Let's call Nick. Let's get set up. Let's prepare for it.
Definitely.
Yeah.
And like I said, you can look up patient medications on DentalRx. You can look up medications that you're going to prescribe on DentalRx. You can look up practice guidelines, look up calculators for dose adjustments, renal dose adjustments, things of that sort.
Let's go through it a little bit. Let's go. Give me a real great little overview of your product, Nick.
Yeah. So, do you want to go through a patient case, for example, or do you want to just go through?
Let's go through all the highlights, the high level of let's glaze over the surface. Yeah,
sounds good.
Yeah, and then maybe we can get into a patient case or whatever.
Sure thing.
Yeah.
So we already went through the patient med history where we can look up patient medications. Next thing we can go over is practice guidelines. So we sort of mentioned anticoagulation, for example. If the patient's on anticoagulation, when should I or should I not hold medication? That would be one example. And we're adding to this hopefully every month. Clinical calculators, where we can calculate things like maximum anesthetic dose, any renal impairment. So this is primarily for like dose adjustments, pediatric doses, opioid equivalencies. So this one's actually helpful too for like, let's say your patient comes in and they have a bunch of opioids on board, right? Sometimes the question is like, oh, if I give them acetaminophen, is this actually going to even do anything? Or if I give them a T3, they're already taking hydromorphone like 4 milligrams every 6 hours. Am I even going to make a dent? You can calculate, see what your opioid equivalency would be.
Nice.
Prescribing monographs. So we sort of went over this as well. If you're prescribing anything, we can come in here for essentially a more in-depth detail of like, should I be aware of anything specific if the patient's on. And then this one we actually recently developed. I developed this 2 weekends ago, actually.
Nice.
So this is the prescription templates module where we can essentially choose, like, let's say patients coming in and they need some triazolam. We want to give some prophylactic amoxicillin as well. There's some evidence as well around prophylactic dex. And they don't smoke, so we don't need that. And then we can preview our prescription. Go ahead and print that for the patient. And it prints out just like this.
Oh, that's super cool.
Yeah.
Awesome.
So took me 30 seconds to write out a prescription.
Mm-hmm.
Can upload that to our practice management software, save it as a PDF, put that in there.
That's right. Yeah.
We're all good.
Very cool.
Yeah. And then lastly, sort of we mentioned as well, you can contact me for BC specifically. And then you can do this by doing a chat. I think this one. Yeah. So you can chat with me.
You're testing.
You can see, I
Hello.
tested a few
times. Is this working? Test.
Is this working? Yeah. And then, yeah. So those are the modules, and that's a live chat as well, that you can work on.
Very cool. I like it. This is a great idea, and you're addressing a need.
Yeah.
And like a evolving substantial need eventually for our aging population that will be on 5 or more medications.
Yeah.
Crazy. How are we getting hold of you, Nick? How, like, if somebody's interested out there, they want to chat about the service?
For sure. So I think the easiest way to reach me is by email right now. You can do that at admin@dentalrx.ca.
Okay. It'll be
somewhere
in the description.
Okay. Sounds good.
Here. Just look below. Yeah.
And then alternatively, if you just look up DentalRx on Google, and actually, speaking of which, we're actually in open access right now. So if you want to try out the application for yourself, you can download it on the App Store as well as Google Play Store, and also at app.dentalrx.ca, which Mark will put in the description.
Oh,
as well.
You should bring it up. Can you bring it up?
Yeah, it's right here.
Let's do it. Click on it. Come on, man.
Do you want me to look it up on Google? Or?
You're the guy. Yeah, let's look it up on Google. Do all the things.
Okay.
I usually do all the things, but you have your computer here, so you can do the stuff.
Fair enough. Oh, it's just logging me in. But if you just go app.dentalrx.ca, it'll take you to the login screen, and you can create an account.
Very cool.
And then it's on, if you just look up DentalRx, it should come up as the first item. And you can also do App Store and the Play Store.
Sweet. Very cool.
Yeah. And like I said, in open access right now, anybody can download it, play around with it, see how they like it. And then on January 15th, we're going back to closed access.
Awesome. So plans for Christmas? What are you doing? Taking it easy?
Working, man.
Yeah, I know.
Yeah. Working hard.
Yeah, that's good. This has been awesome, Nick. Thanks for coming into studio. We've already lined up 5 episodes coming up.
Yeah, I think so. We got the next 5.
Absolute pleasure. I look forward to seeing your success with this. This has been awesome.
Great. It was great to be here.
Any final thoughts?
No, I don't think so.
We went through all your pearls?
Yeah, I think so.
Sweet. Are you satisfied? Yeah?
Yeah.
Okay.
I'm happy.
Okay. Then we can say toodaloo.